Pain is a critical clinical indicator, signaling underlying pathology that requires prompt evaluation by healthcare professionals. As clinicians, it is essential to recognize pain as the body's alarm system, a sign that warrants thorough assessment and intervention. Pain may present as acute, such as a sharp injury, or as a persistent ache following surgical procedures. Effective pain management is a cornerstone of quality care and should be prioritized in every clinical setting. Ignoring or underestimating pain can compromise patient outcomes and delay recovery. Adhering to evidence-based guidelines ensures that pain is managed safely and effectively for all patients. Comprehensive pain assessment tools, such as numeric rating scales, are vital for consistent evaluation and communication among care teams. Regular reassessment and documentation are essential to monitor progress and adjust interventions as needed. By prioritizing pain management, healthcare teams enhance patient recovery, satisfaction, and overall quality of care. Consistent communication and collaboration among providers are key to delivering optimal pain relief and supporting best practices in clinical care. In clinical practice, accurate pain assessment is essential for effective patient care. The Numeric Rating Scale, or NRS, is a simple and widely used tool. Ask the patient to rate their pain from 0, meaning no pain, to 10, the worst pain imaginable. Document the patient's response clearly in the medical record, noting both the number and the context of the pain. The NRS helps clinicians track pain severity over time and evaluate the effectiveness of interventions. For patients who have difficulty with numbers, such as children or those with communication barriers, use the Wong-Baker-Faces Pain Rating Scale. Present the scale and ask the patient to point to the face that best represents their pain level. Record the selected face and corresponding number in the patient's chart, ensuring consistency in documentation. Remember, not all pain is the same. Distinguish between acute pain, which is short-term and often has a clear cause, and chronic pain, which persists beyond normal healing. Make pain assessment a routine part of every patient encounter, and communicate findings clearly with the entire care team. Consistent, thorough pain assessment is a cornerstone of quality patient care. In clinical practice, distinguishing between acute and chronic pain is essential for effective patient care. Acute pain is typically a direct response to tissue injury and serves as a protective mechanism. The primary goal in managing acute pain is to alleviate discomfort while addressing the underlying cause, such as injury or surgery, to promote optimal recovery. Chronic pain, however, persists beyond normal tissue healing time, often defined as pain lasting more than 3 to 6 months, and requires a different clinical approach. Opioids are potent analgesics indicated for severe acute pain, such as post-surgical or traumatic injuries, when other treatments are insufficient. Evidence-based guidelines recommend using the lowest effective dose for the shortest duration, with close monitoring for adverse effects. For chronic pain, opioids are generally not recommended due to the risks of tolerance, dependence, and addiction. Non-opioid and non-pharmacologic therapies should be prioritized. Providers must educate patients about opioid risks, monitor for signs of misuse, and implement safety protocols such as prescription monitoring programs and regular follow-up. By following evidence-based practices and maintaining open communication with patients and the care team, clinicians can help ensure safe and effective pain management. As healthcare professionals, it is essential to recognize the risks of opioid dependence and addiction when managing pain. Even with a legitimate prescription, some patients may develop substance use disorders. Vigilance and patient education are critical. Carefully assess each patient's needs and consider alternatives before prescribing opioids. If opioids are necessary, ensure clear communication about safe use and monitor for signs of misuse. Always instruct patients to take medications exactly as prescribed and to report any side effects promptly. Reinforce the importance of not exceeding recommended doses or frequency. Advise patients never to alter medication forms, such as crushing or breaking pills, unless directed by a pharmacist. Caution against mixing opioids with alcohol, benzodiazepines, or sleep aids due to the risk of dangerous interactions. Review all current medications to prevent harmful combinations. Collaborate with pharmacists and other team members to ensure patient safety. Multimodal pain management, combining non-pharmacological and pharmacological therapies, reduces risk and improves outcomes. Physical therapy, occupational therapy, and psychological support are key components of safer pain management. Educate patients about realistic expectations and the benefits of non-drug interventions. encourage the use of cognitive behavioral therapy, mindfulness, and relaxation techniques as part of a comprehensive plan. A multidisciplinary approach involving nurses, doctors, therapists, and pharmacists is the gold standard for chronic pain. This strategy addresses the whole patient, not just their pain score. Use a variety of evidence-based tools and techniques to improve function and quality of life. By working together, healthcare teams can provide safer, more effective pain relief for every patient. Safe pain management begins with the healthcare provider. Clinicians must assess each patient's pain thoroughly, considering medical history, risk factors, and treatment goals. Providers should encourage open communication. Allow patients to describe their pain in detail and discuss expectations for relief and function. When opioids are considered, providers must evaluate the necessity, prescribing the lowest effective dose, and setting clear treatment plans. Providers should schedule regular follow-ups to assess pain control, side effects, and signs of misuse or dependence. Providers must educate patients on medication safety, stressing the importance of taking opioids exactly as prescribed and never sharing medications. All team members should be familiar with safe prescribing practices, risk assessment tools, and protocols for opioid use. Safe disposal of unused opioids is a shared responsibility. Providers should instruct patients to return unused medication to authorized take-back programs or follow FDA disposal guidelines. In managing chronic pain, the objective extends beyond symptom elimination. The focus is on restoring patient function and enhancing quality of life through evidence-based, multidisciplinary strategies. Rehabilitation is a cornerstone of long-term pain management. Physical and occupational therapists collaborate to design individualized programs that address mobility, strength, and daily function. Regular interdisciplinary collaboration meetings ensure coordinated care, integrating input from physicians, nurses, psychologists, and pharmacists. Mind-body techniques, such as cognitive behavioral therapy, mindfulness, and relaxation training, are supported by strong evidence for reducing pain intensity and improving patient outcomes. Encourage patients to engage in self-management strategies, including graded activity, pacing, and goal setting, to foster autonomy and resilience. Professional development workshops and continuing education are vital for staying current with best practices in pain management. Utilize educational graphics and validated assessment tools to monitor progress and adjust treatment plans as needed.